In this video, I am going to show you how to document a nursing narrative for the first couple of lines. If you are documenting extremely well, whoever is reading your documentation should be able to visualize what that patient looks like, what they're capable of doing, and what is going on with that patient. So let's get started with these first two lines. Did I say first two lines? I obviously got carried away once I started making this video. My apologies. So let's talk about what I have written here. This is just a brief introduction to what the first few lines of a descriptive nursing narrative may look like. So we have a 71-year-old Hispanic female who is pleasant. As you can see, I'm putting here how the patient is. This is letting the reader know that, hey, this is a very pleasant Hispanic female. She knows English. She is English speaking, but her primary language is Spanish. Now, why would I put this here? I put this here because if you have a really good instructor, they have informed you that discharge preparation begins on the first day that the patient is admitted. So something that I've seen in a few states across this country is that people are sending patients home with discharge papers that are not in their primary language. As the nurse, you are responsible for asking that patient, hey, what's your primary language? Which language would you prefer to have your discharge papers in? Because maybe that patient is not going to be the one reading the discharge papers. It is your responsibility as the nurse to clarify with that patient how they would like their discharge information. So this is why I have included this in my narrative. I'm making it clear to anyone who may be reading this that the patient does understand English well. They speak it well, but their primary language is Spanish. And since this video clip can only be 3 minutes, I'm only going to discuss the alert and oriented here. So we can no longer put just alert and oriented times 2 or times 3. We can put alert and oriented times 4. But if you were to put alert and oriented times 2 or 3, the person reading it would be like, alert and oriented to what? So as you can see, I have written it out as you should do too. The person is alert and oriented to self, place, and situation only. You must write that out. You should not write alert and oriented times 3.